Might be some airport delays and a high of 72 degrees. Well, welcome back to the most news in the morning. A potential presidential candidate says it's time for the Republicans to step up with ideas on health care. Louisiana Governor Bobby Jindal wrote an op-ed with 10 of his ideas, many in line with the bill that could come up for a vote today in the Senate Finance Committee. Joining us now from Baton Rouge, Louisiana, is Governor Bobby Jindal. Governor, great to see you this morning. Thanks for coming on.
John, thank you for having me. Good morning.
Let me quote a little bit from the op-ed that you had in the Washington Post on Monday. You said, quote, "Hope for meaningful reform need not be lost. Only two things need to happen. First, Democrats have to give up on their grand experiment and get serious about bipartisan solutions. Second, Republicans have to join the battle of ideas." Governor, where have the Republicans been up until now?
Well, I think the Republicans have done a great job articulating the country's opposition to massive tax increases, government takeover of health care. Look, the American people don't want this 1,000-page bill that has $900 billion of new spending and new taxes, but now is the perfect time for Republicans to say to the Democrats, look, we're willing to work together on things like legal reform, on things like portability of insurance, things like transparency of pricing and outcomes on the Internet, things like portability of insurance across state lines and across jobs, coverage of pre-existing conditions. I think there are real bipartisan reforms that could lower the cost of health care, make it more accessible. We can actually move forward. If we'll put aside the massive tax increases, the massive new government spending, there's a lot of very good bipartisan work we can get done.
Is it politically prudent, though, to start coming up with ideas? You know, the Republicans have sort of let the Democrats own this idea of health care reform, looking back at 1993 when it really sunk their fortunes in the 1994 midterm election. And there are some people who are saying, hey, don't come up with any ideas, just keep hammering the Democrats for what they're doing wrong.
John, that's a great point. You know, for a lot of Republican strategists don't think that this is a Republican issue, and I think that's exactly wrong. I've spent most of my adult life working in health care as a health secretary in Louisiana, as an assistant secretary at the Federal Department of Health, helping to run as an executive director of the Bipartisan Commission on the Future of Medicare. I think conservative principles and ideas work, and I think it's important for us to suggest conservative approaches to resolving an issue that I think the American people are rightfully worried about. Look, Americans if they have health care today, they like their coverage, but they're worried about it becoming increasingly expensive, and there are millions of Americans that don't have access. I think there are productive solutions that conservatives can offer. It's not enough just to point out why we're opposed to the other side, and I think we've done that well, and I think we've got good reasons to be worried about the tax and spending increases. But now's the time to show how our ideas can actually move the country forward.
So you're drawing a little bit of fire on some of the ideas that you're putting out there, and I'd like to highlight a couple in particular. You have this idea of covering young adults, and I guess most insurance companies, when a child gets to a certain age, they're no longer eligible to be covered by their parents' health care insurance. You are saying that they should be permitted to stay on the parents' health insurance. How do you convince insurance companies to do that?
Well, look, insurance companies have to be in the business of spreading risk over large populations. That's why we buy insurance. Today, too often, insurance is about segregating risk. That's not good for customers. That's not good for health care spending or coverage. Why is health insurance so expensive, so hard to get when you need it the most? This reform would actually lower premiums because young adults are generally pretty healthy. A lot of times they can't afford coverage because it's so expensive on the individual market. This reform would expand coverage, but it would also lower premiums because you're adding a relatively healthy pool into the insurance coverage. But this goes to a fundamental point. We've got to change our relationship with insurance companies. It needs to be about spreading risk over large populations. That's why I'm also for covering pre-existing conditions. Not everybody's for that, but you don't just need insurance when you're healthy. You need insurance when you need it, and that's why it's important that we reform insurance. It should be about covering risk across large populations.
One of the people that's against your idea of covering pre-existing conditions is Michael Cannon from the Cato Institute, who in response to your op-ed on Monday wrote this piece for Politico in which he said, quote, "Require coverage of pre-existing conditions? That's code for federal price controls on health insurance." What do you say to that argument?
Well, I don't agree with that, and I certainly am against this idea in the massive bills in the Congress to get the government to run and control our health care. Look, you can do things like reinsurance, high-risk pools, and others to make sure that you don't have people only buying insurance when they get sick. But it is absolutely true. One of the problems with the insurance industry, with the insurance coverage today, one of the reasons so many Americans are frustrated is that if you do have a sick child, or if you have had a condition, you lose your job, it can be nearly impossible, too expensive to buy coverage. We have to fix that. We have to show that you can address the very real concerns of Americans looking for affordable health care without expanding Medicaid dramatically, without creating new government programs, this is a common sense reform that would work.
There's one other criticism of your proposals out there, and this one was actually in the Washington Post itself, which is where your op-ed appeared, pointing out that 9 of the 10 ideas that you put forward are already in the process in some form or another. You actually alluded to the fact that they're in there, but here's what the Washington Post said, quote, the health insurance exchanges, that's the government's idea, make the voluntary purchasing pools that you're proposing look silly and small. It's a bit hard to, quote, lead on health care reform when your brand new proposals are about to be passed by the other party. So are you really putting anything out there that's new, Governor Jindal?
Well, 2 things. One, I'm glad you brought that up. One, it's not true. When you look at the ideas we've proposed, like tort reform, yeah, the Democratic proposal talks about demonstration projects, but why not do this in a meaningful way? Could save, it literally costs, defensive medicine costs up to $100 billion a year. I talk about using refundable tax credits. The Democratic proposals talk about a massive expansion, the largest expansion of Medicaid since the program was created. So it's simply not true that they're actually embracing all of these ideas. But the second point is this. That's great. You know, if they're willing to drop the 1,000-page bill, willing to drop the hundreds of billions of dollars in tax increases, of spending increases, the Medicare cuts, they're willing to drop this idea of new government programs, I think there may be good ideas. Look, in 1,000 pages, I would hope there are a few good ideas. My point is, let's find common ground. These shouldn't be Republican ideas. It's not about credit. Let's call them Democratic bipartisan ideas. Let's just get them done. But to get this done, we have to stop this massive government experiment, this massive overhaul that's being proposed in both the House and the Senate. Let's focus on common sense bipartisan reforms that will actually work.
Well, the discussions continue. Governor Bobby Jindal of Louisiana, good to talk to you this morning. Thanks so much for coming on.
Thank you, John.
Appreciate it. Karen?